नमस्कार, मैं हूं डॉक्टर मनीष सिंघल, मेडिकल oncologist at Apollo Hospitals, Noida and Delhi से. Today we are going to discuss about cervical cancer vaccine. It has been shot to fame now since India has launched the new cervical cancer vaccine prepared by the Serum Institute of India. Therefore, there is resurgence of interest in knowing about cervical cancer vaccines. Much to the envy of the Western world, this vaccine, which is made by India, is available at 1/10 the cost of which is available outside. Therefore, it is important that we understand about this vaccine and we understand about the importance of cervical cancer vaccine. Cervical cancer vaccine word is actually wrong. It should not be cervical cancer vaccine. It should be HPV vaccine. You would be surprised, आपको अचंबा होगा ये जानकर कि इंडिया contributes to 20% of the world cervical cancers, which means cervix is nothing but the end part of vagina or the initial part of the uterus, and cervical cancer is one of the most common cancer that affects women. And of the total cancer burden of cervical cancer in the world, इंडिया का कंट्रीब्यूशन 20% है. ना केवल ये, most of the cervical cancer occurs in the age of between 40 to 55, which is the productive life of the individual. When you are still otherwise healthy, there are a lot of expectations from you to complete family life, etc. Not only this, 3/4 of cervical cancers are in locally advanced stage, where the cure rate is 60% only. Because we don't have a very strong cervical cancer screening program, जिसमें हमें पैप टेस्ट कराना चाहिए हर 3 साल में 31 साल की उम्र के बाद से, क्योंकि वो प्रोग्राम बहुत स्ट्रॉन्ग नहीं है, एक हेल्थ केयर इम्पेरेटिव नहीं है, इसलिए अपॉर्चुनिटी टेस्टिंग होती है. आप गायनेकोलॉजिस्ट के पास चले गए तो पैप टेस्ट हो गया, लेकिन अपने आप में इट इज नॉट समथिंग विच इज कंपल्सरी. इट्स नॉट अ हेल्थ केयर इम्पेरेटिव बाय द गवर्नमेंट. So cervical cancer vaccine is the easiest way to prevent cancer altogether. जैसे मैंने कहा, the word cervical cancer vaccine is wrong. It should be HPV vaccine, human papilloma virus. Therefore, it is important to describe what is the pathogenesis of human papilloma virus and cervical cancer. Since cervical cancer is common, it is important to understand that 100 out of 100 cervical cancer occurs because of human papilloma virus. Human papilloma virus is transmitted by sexual intercourse. That means it is present in male as well as female. So why only cervical cancer? Why not other cancers? Why not penile cancer? We have also known, and it is now becoming very famous, and a daily newspaper is telling us now male to male and female to female marriages are becoming common. Therefore, HPV vaccination is meant for such individuals also, because it can lead to anal cancers and also oropharyngeal cancers because of oral sexual practices. So, the word cervical cancer vaccine is not complete. It is not wrong, but it is not complete. It should be HPV vaccine, both for males and for females. If the male is vaccinated, he is not likely to transmit the infection to the female. Therefore, the female, even if not vaccinated, can be protected from the effect of human papilloma virus. So everybody has to be vaccinated. What is the right age to get vaccinated? When to get vaccinated? The right age for vaccination is between the age of 11 to 14 years. That means before sexual maturity happens, the vaccine should be given. And in this population, you can get away with only just 2 vaccines. That means at 0 and 6 months. But before we go on further, because human papilloma virus is 100% linked with these cancers, especially cervical cancer. The link of human papilloma virus for oropharyngeal cancers is not 100%. It's because oropharyngeal cancer can occur because of tobacco, smoking. Over there, it is 15%. Penile cancers may be around 40%. Anal cancers may be about 40%. But since cervical cancer, it is 100%, therefore, almost 100%, 98%, you can say. So, therefore, we call it cervical cancer vaccine. A few important timelines. It was in 1983, 6 years after I was born. That is how I remember it. The link of human papilloma virus was linked to cervical cancer in 1983, first time. It was in 2006 that the first cervical cancer vaccine was made. It was called as Gardasil. It was done by MSD company. So it took that much time for it to be established as a vaccine. It was approved in India in 2008 or 9 after a few studies were done in Gujarat by the international vaccine makers. And very lately, 2021, the Indian vaccine was rolled out and it was recently approved. Now, who should be vaccinated when? The ideal age I have already told you. A catch-up vaccination, that is after 15 to 25 years of age, 3 vaccines are required. That means 3 doses are required, and that can be done. And up till the age of 2045 also, you can get vaccination by again 3 doses. This is catch-up vaccination. It is not a standard recommendation, but it is called as catch-up vaccination. In case you are not vaccinated by 25, you can still get vaccinated. But the protection level goes down because it is based on the assumption that the person is sexually active. Some human papilloma virus has already entered, and therefore vaccination may not give you 100% protection. So that is one thing. Males should be vaccinated again at the same age, and they should receive 2 doses of vaccination. Now, since there are multiple vaccines available, Cervarix, Cervovac, that is Indian vaccine, Cervarix is Glaxo vaccine, Gardasil 4 and Gardasil 9, which is 9 viruses. It was in 1997 that WHO defined human papilloma virus 16 and 18 to be carcinogenic. That means it causes cancer. 96, 97. It was in 2007 and 8 they labeled HPV into various subtypes. It was 16 and 18 in 1995-96. In 2007 or 8, they defined that there were multiple other human papilloma viruses which can cause cervical cancer. They were namely 31, 33, 35, 39, 41, 45, 51, 52, 55, 59, and 66. There are many subtypes of human papilloma virus. We all know about coronavirus, we know about Omicron, we know beta variant, alpha variant, so on and so forth. So we wanted vaccination for every subtype of the coronavirus. Similarly, human papilloma virus has many subtypes. They are named in the number 31, 33, 35, 39, 41, 44, 45, 51, 52, 53, so on and so forth. The numbers are not important. The importance is that means the initial vaccine which was made in 2008, the first vaccination, it was only against 1680, which contributes 70% of the human papilloma virus induced cancers, 16 and 18. And 6 and 11, which does not cause cancer, 6 and 11 only causes genital warts. So HPV 6 and 11 causes genital warts, 16 and 18 causes cervical cancer, and it accounts for 70% of the total cancers. 6 and 11 only causes genital wart, which is benign tumors. The first vaccine, Gardasil 4, which was 6, 11, 16 and 18, was rolled out, and it counters only 16 and 18. So we know that 70% of cervical cancers are caused by 16-18. What about the rest? 31, HPV 31, 33, 35, 39, 41, 45, 49, 51, 52, 53, 66. What about them? So therefore, Gardasil 9 was launched, which counters many other HPV subtypes. Therefore, Gardasil 9 seems to give you a broader coverage of human papillomavirus and gives you a better coverage and better protection from cervical cancer. Because it is directed against so many L1 proteins of so many HPVs. Therefore, if you ask about which vaccine, irrespective of the cost, so Gardasil 9 seems to giving the best coverage. Gardasil 4 being the first one has the longest efficacy data. The endpoint of the Gardasil force was protection from CIN2 and CIN3, which was almost reaching 100%. CIN is carcinoma in situ or cervical cancer intraepithelial neoplasia, which is the starting point of cancer. So their endpoint was very robust. Their endpoint was protection from CIN, which was almost 96 to 100%. Whereas the endpoint of Servavac, which is the Indian vaccine, is only immunogenicity. The endpoint of protection from CIN has not been reached so far. The studies are ongoing. But the immunogenicity is 100% to its international comparator. Immunogenicity is the amount of immune reaction the body makes against the virus. So, cost being 1/10, of course, it is important that we vaccinate most people. WHO has given a timeline that by 2044, America will be able to wipe out cervical cancer by this vaccination in their affluent population, and by 2060, if I'm not wrong, in the entire US population. Similar timelines have been set for the world also by WHO. To meet these guidelines or these timelines or these milestones, it is important that most people should get vaccinated with whichever vaccine is available to them at whatever cost. But if academic answer is to be given, then Gardasil 9 seems to give you the best coverage, and the timely vaccination is the key to success. That means our young children should get vaccinated, irrespective of female or male, all should be vaccinated. Two vaccinations are essential, but three vaccinations if you miss the age group. Then three vaccinations is required. 0, 2 and 6 months. Otherwise 0 and 6 months is good enough if at the right age vaccination is given. Protecting the male as well as the female is important because the concept is of herd immunity. Infection travels through sexual intercourse, and therefore protecting both the groups is very important. I hope this would be useful. Thank you very much for your patient listening. धन्यवाद.